How to reverse lesions and relapses in patients with multiple sclerosis. What has been clinically proven? What's been tested in a clinical trial? That's what we're going to be talking about in this video. Firstly, what is a lesion? A lesion is basically a part of the brain, or can be in the spinal column as well, can be in the spinal cord as well, where a significant amount of demyelination has occurred. And when what is demyelination? That is basically where the covering of a nerve gets basically eaten away. This happens due to neuroinflammation when the immune system attacks the myelin sheath, and the myelin is basically the insulation over nerves. So what happens is when a significant amount of that occurs in one region of the brain, it shows up as a lesion on an MRI. So basically when this happens as well, the nerves become exposed, and so the brain processes that as pain most of the time. But there's tons of symptoms associated with multiple sclerosis. So the point of this video is what can actually reverse the lesions and what can actually reduce the amount of relapses that people with MS experience. Well, relapses is when the condition comes back and it gets the symptoms start to become more aggravated, and the thing that solves this is yarrow, also known as Achillea millefolium. This was used in a clinical trial with patients who had relapsing remitting multiple sclerosis, and at the end of the study it was found that these patients had reduced amounts of relapses, annual relapses, as well as a the total volume of lesions had also reduced. So I'm posting that study in the description of this video. And it's very important to consider this because a lot of people, they're unaware of the medicinal value of certain herbs and plants. And the thing is, these things are clinically tested. They go through clinical trials. There's actually huge companies out there that do hundreds of studies on their natural formulations. If you live in the United States, you don't usually have too much access to that because there's rules. Even if a medicine is classified as a drug outside of the country, when they come into the US, they have to be classified as supplements. There are many things that can help for multiple sclerosis, not just for relapses and for lesions, but for other symptoms associated with it, like the fatigue or the cognitive decline that occurs later on in the illness, or even there's honestly, at the top of my head, there's at least 20 things that have been used in clinical trials that have even improved the quality of life in patients with MS. And so there's a lot of options out there, and I'm going to be sharing as many of them as I can, as many of them as I have time to share. I do share these with my clients and my patients, and if you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online consults for people all over the world, and I can share these things with you. We can go through your case. And yeah, it's most importantly, when you're searching for natural things that work, keep in mind that you should always look for clinical evidence that backs it up, because there's a lot of people out there who make claims, and these claims are not backed by any research. Even if it's experimental research, even if it's animal studies, something needs to back it up, but preferably clinical trials. That's the responsible way to do things. And yes, that's my take on how to reduce relapses and lesions in patients with MS. And in the next video, we'll be talking about fatigue. So I'll see you in the next video.